on how to handle medical legal cases. Then we try to ask ourselves, why is it difficult for doctors and then healthcare workers to handle medical legal cases? Then touch a bit on why is it even important that some cases be treated as medical legal cases. Then we conclude. So whenever you see me talking about doctors, I want to say, and from the start, that it does not only apply to medical officers or doctors, but all healthcare professionals who are part of the patient journey may be subjected to these medical legal issues. So it's for all of us. So pardon me if I use this interchangeably. So all of us, regardless of our specialty or our level of grade, once we are doctors or healthcare professionals, at one point in time, we'll be faced with medical legal responsibilities in the line of our duty. We have ethical and legal obligations as we discharge or perform our duties as doctors. And unfortunately, the training always emphasizes on how to take care of the sick and not so much on how to handle sick people who have legal problems. So healthcare workers, sometimes may be required to support the judicial or legal system to deliver justice, to fight crime, and then to create a fair and safe society. So the point where medicine and law entangle, at that point of entanglement gives birth to the cases we famously describe as medical legal cases. Elsewhere, medical legal cases are handled by, or especially by, a field of medicine called the clinical forensic medicine or forensic medicine. So, but in our system, we are not yet there. We all handle, and we are all supposed to handle medical legal cases based on our training, expertise, and then professional ethics. So all routine medical cases that have legal importance fall under clinical forensic medicine. So you may find this as a topic in pathology books, or you may find it separately as a specialty. Now, medical legal cases in this sense, usually, majority of them are dealing with live patients, but I would say it is not only live patients that are involved, but the death. And this one we'll see later on how to also take care of such instances. Why is it that cases of death are also included in medical legal or clinical forensic medicine? It's because as we practice, every now and then we are called to perform a very sacred duty of declaring somebody dead or otherwise. Every now and then we are called to issue medical cause of death certificates and other related documents. We are also called to perform autopsy if it is within our skills or specialty, to write various reports, and then we may be called to give to perform the duties of expert witness in the court of law. So what is medical legal case or a medical legal case? It's defined as any case or injury where the attending doctor, after assessing a patient, thinks or have reasonable cause to believe that some investigation by law enforcement is essential to establish and fix responsibility for the case in accordance with the law of the land he or she practices. So here we are saying you are doing your work, taking care of the sick, restoring health, easing pain, and you feel that something is not normal, and that requires that law enforcement should come into the matter to find out who caused what or who by their omission resulted in the kind of injury you are handling at that particular moment. It can also be defined as a case of injury or ailment in which investigations by the law enforcing agencies are essential to fix the responsibility regarding the causation of the said injury. In this case, you, the medical person, may not be the one thinking or feeling or trying to make a case of a medical, trying to make a case medical legal case, but the legal system itself may bring forth some case to you, and then you have the role to play there. So for me, simply put, a medical legal case is any medical condition with potential or actual legal implications. Now, any legal case requiring medical expertise when brought by law enforcement, the police, or officials of the court for the professional opinion of a clinician also constitutes a medical legal case. In this country, not long ago, some big man, I would say, spoke carelessly, and the big traditional ruler invited him to come to the palace immediately or face some consequences. And within the matter of hours, the loudmouth, popular man ran to the hospital to get himself admitted and show the picture of him in the hospital as proof that he is not well and cannot honor the invitation. We have also seen another loudmouth politician who insulted judges, and when he was summoned, he quickly secured a medical excuse duty. And the doctor who issued that excuse duty was called upon to come and answer questions. So you see, they may appear trivial, but they are very important. And our role is so powerful, so important, but sometimes we lose sight of it, and other people rather exploit us. What is our role as health workers and doctors in medical legal cases? Well, we are all legally bound to attend to patients, regardless of their tribe, economic status, race, gender, all those things. And we cannot refuse to treat or withhold treatment from patients or clients. Every doctor, once in a while, has to fulfill some legal requirement in service. And this may be voluntarily, or by compulsion. You may have handled one patient, and in the end, the matter lies in court. And so whether you like it or not, the court will order you to come and then answer some questions. So examining and writing reports on legal issues regarding people who have medical conditions is a very important responsibility of all doctors working in a hospital. How do cases originate or become medical legal cases? I would say some cases, broadly, most of these cases are brought by the police or the legal system, and others, very, very few others, are targeted at the healthcare worker. The healthcare worker becomes the soft target. So in the first instance, there are some cases that police do not need warrant to arrest culprits or suspects in cases of murder, armed robbery, all those things. So such criminals, when they are arrested, can be brought to the hospital for a doctor to write one report or the other, usually an injury, to give an injury certificate or medical report. Then there are those cases that the injured person, maybe two people have fought or there's a disagreement and one assaults the other. The assaulted person runs to the hospital directly that this is what has happened to me. I want you to give me medical report so that I'll send it to the police. I have seen when I sat in the court and I listened to a case where a young man was crossing the traffic when it showed red. And when he was arrested, he tried to free himself and then he beat the police officer. So you could see the bite marks. The police officer reported the matter. The young man was tried and then asked to pay a fine. I think it was about 6,000 Ghana cedis or 2,000 Ghana cedis, or in failure to pay that amount, he will go to jail for 6 months. So it may happen that way, that somebody who has suffered a trauma or injury or ailment as a result of commission or omission by another person makes a complaint to the authorities, and the authorities direct them to you for medical report. Then we have the very few cases where you are a doctor, you are sitting down somewhere, you might have performed some duty some time ago, and then something leads to something, they report you, and then you are called to answer or to support the legal system, clarify some issues based on your expertise. The examples of medical legal cases are numerous, and the list is unending. They even get more complex as society develops and then people are more enlightened. We are seeing attempts to increase the intake into the law school. We have seen the scenario where healthcare workers, other people are running into the law profession. So having this dual knowledge and having access, easy access, definitely would increase the population's knowledge about medical legal cases, of such that they'll be running to courts or the legal system to seek justice or redress for some act or omission of medical personnel. So these are a few examples. Number one is all accidental injury cases, whether from vehicular, factory, or labor related. So on the 2nd of January, a cousin of mine was working somewhere in Koforidua. He had just gone to join this group of block layers, and then as they were working, their vehicle got stuck. And then as they tried to, a truck came to drag this Kia truck that was stuck in the mud. And then he slipped and fell, and the vehicle ran over him, and he died. This was like the second day the guy went to do the work. But once it was during the work, the company had some liability or responsibility to answer to. All alleged cases of assault, whether it is suspected or confirmed, all cases of burns. My intention here is not to tell you what to do with these cases. I just want you to know the list first, and then we'll zoom into a few of them. Cases of suspected or evident sexual assault. This one is very important, and we've been hearing in the news of late some cases of sexual assault. All cases of suspected or evident criminal abortion. Once the word criminal appears there, there's no need saying that it's a medical legal case. And we all remember the definition of illegal or criminal abortion in our medical day training. Cases of suspected or evident poisoning or intoxication, whether acute or chronic. Victims to animal ferocity. Victims of snake and insect bites. All unconscious or comatose patients. All cases brought in death or mass deaths. This is a very complex one, and we'll talk about it later on. Further examples of medical legal cases include mass food poisoning. I remember when we were in medical school, I think the penultimate year, there was this birthday organized by medical students where the celebrant sent some butter that was laced with a substance which was later found to be weed, that they should use it to make the cookies so that they will have fun with their birthday. All the attendees of this birthday who ate this thing started vomiting and having symptoms of poisoning with this weed. And I remember Dean stepped in and handled the matter. The birthday celebrant was arrested and they're taken through the process. Some of the parents of these people who ate this thing wanted a medical student to be sacked and sent to jail. Long story short, all mass poisoning are cases of medico-legal importance. Cases of drug abuse, drug overdose, or anaphylactic reactions. This is important because it's not always the intention to punish somebody, but to learn from this and prevent recurrence. So if I'm buying, there was this anti-snake venom from India. Almost everyone that used it on their patients had some concerns. Their anaphylactic reactions were quite severe. And so if we are able to treat such cases like this and we find out that this is not helpful in our system, we have justification to stop the importation, sale, distribution, and use of such drugs. All cases of suicide are medico-legal cases or self-injury, para-suicide. In fact, last year, May, the para-suicide or attempted suicide was scrapped off the law books and is no longer criminal. But suicide is still a criminal offense. So attempted suicide in Ghana is no longer a criminal offense, but suicide is. Now, cases referred from the court or otherwise for any reason are medico-legal cases. And cases brought against medical professionals by clients and or relatives. And this is what we are seeing on the rise recently. All cases of persons whose freedom has been withdrawn. So I'm here, God forbid, and I'm arrested. My freedom is taken away. The state is supposed to take care of me. Even if the prisoner dies, they still have to get an autopsy done to prove that it was not from torture or maltreatment, or whatever be the case. If it's natural, fine. If it is not, then the people who are keeping these people will answer. So prisoners, suspects in custody, inmates of mental hospitals, they are all medico-legal cases if they sit in front of you. All cases of abandoned or neglected children or adults. Most of us are getting busy and busier. So we tend to forget our elderly folks at home. If it is found that you have neglected your elderly person, leading them to have malnutrition, dehydration, all those bed sores and problems, you can be found wanting. Cases of disabled persons or cases whose treatment or handling may result in disability. For example, if somebody has a road traffic crash, comes with a mangled extremity, you know that after your mangled extremity score, you are going to do an amputation of a sort, which will lead to disability of that person. You need to be careful that this is a potential legal case. All cases involving foreign nationals. I remember I was there in UDS one fine Thursday morning. A bus was traveling from Mali to Accra. When they passed the PC barrier, a woman got down to Wiwi and collapsed. They rushed the woman to UDS clinic. I found the random sugar was unrecordable. We started the usual fluids and then the insulin and all that. And then It came down to 33, 20. Finally, the woman was fine on the third day. So she went to buy a ticket to continue the journey. Unfortunately, she couldn't get. She came and pleaded with my staff that she wanted a place to stay till the next day. They secretly took her in without my knowledge. She went out to Bamahu to eat. When she came back, I don't know what happened. She was gasping for breath and died. While she's not a Ghanaian, this is a medical legal case. I had to report to the police. They had to report to the embassy. Mali was holding their elections. The borders were locked. It was not easy, but eventually the family came and the matter was sorted. Autopsy done, and then she was buried. So was a Chinese contractor at the Dungu UDS who in the construction process fell from the building and died. All those foreign nationals, any foreigner that is coming before you for healthcare is a medical legal case for you. You have to be careful. There are a number of cases that I cannot list all here, but at least you have a fair idea of some of the very common examples. So let's look at accidents. The word accident means unplanned, unpredicted, unforeseen. So indeed, when you have a case of alleged accident, you have to elaborate on the setting and origin in your history, where it happened, home, whether it is at home, on the highway, in an industrial area, the motor vehicle, whatever happened, you have to let it come out clearly. If you suspect foul play or abuse or neglect, that even makes it much more glaring to label this case as a medical legal case and probably inform or intimate the police. When people are involved in road traffic crashes and sustain head injury, in this case, their mental status is altered and they are not able to understand, give consent, or participate in their treatment process. You have to be careful that this is a potential legal case. We must know about these cases because there are implications. And to understand the implications, there are financial or economic implications that people may need to be compensated. As I mentioned, my cousin who died in Koforidua on the 2nd. There may also be the need for employer or the work environment to be sanctioned, to be their operations to be reviewed, their license, and a whole lot of things. We were here in this country when a plastic surgeon who was working, eventually MDC descended on the person and all that because of a client that was operating on. So as doctors, we must be abreast with the current guidelines and standards of handling trauma, injuries, or accidental cases in line of duty. Assaults, whether alleged or confirmed, most of them are trauma cases, and the trauma types are usually, the commonest is mechanical trauma. By nature, they can be homicidal or suicidal or sexual. A homicide means someone by action or omission causing the death of another person. And then this is not a legal terminology. The legal people will now add whether the person was sane, having a sound mind, and whether the person had intent. And based on this, you can now clarify legally as a murder, manslaughter, or those that are legal. But homicide is a fairly medical term that you can use. Suicide, somebody taking their own life, and it can be sexual. Most of the time, the number one, homicidal and sexual ones may be Then the nature may be homicidal and sexual in nature, especially if it's between a man and woman. But we know that these days there are gays and lesbians among us. The important thing to note here is to accurately document the essential things. In fact, all the medical legal cases that are listed in the previous slides, we have something we will call the medical legal aspects of so and so. So medical legal aspects of assault, medical legal aspects of intoxication, medical legal aspects of an unconscious patient. You can put your specialty there, medical legal aspects of, say, internal medicine, ophthalmology, and you'll be surprised what you come out with. We need this proper documentation for interpretation of the injuries and reconstruction of events, and also to assist in deciding the motive. If you remember what I said about intent and then sound mind, this one, it will help us in that regard. All burns cases, and burns come in different forms. It can be from dry flame, moist heat, or boiling liquid. Some people call that scalding. Chemical burns from corrosive acid or alkali, electricity, lightning. Lightning can strike somebody, and at autopsy, there's a very pathognomonic skin sign that you will see. Radiation burns, all these are potential sources of burns. When you're handling burns, we all remember the rule of nines. If it's a baby, there's a way to calculate that. But at the end, when you clot this patient, it must be evident the severity of the burn, the type of burn, the total surface area of burns. We know that for cases that have total body surface area of burn, more than 1/3 of the whole body, then you have to intimate the police that it's a medical legal case. Our duty is just to report or intimate. We don't have to now say somebody is guilty or not. It is their job, but we are all afraid to do that. Alcohol intoxication and illicit drugs. Usually, a highly alcohol intoxicated person is brought accompanied by police or relative to the ER or the hospital. And you are torn between how to take consent from such a person. He is already intoxicated, but is an adult who should be able to take decisions. So will you listen to the police or the relative? If it is a police where they are suspecting that he might have committed an offense or something, it's much easier. You can go ahead and do it. Or if this person has drunk to stupor and is unconscious and requires emergency care, you can go ahead and do it. But other than that, if they are still conscious and talking, most of them talk very foul and very irritating language. To seek consent from them to take care of them may be problematic. You may need for legal or evidence purposes the blood alcohol levels. And I know in the clinical forensic medical setup, there's a way to certify drunkenness, which most of us do not know. Then I even want to ask all of us, do we know if there's a figure cutoff point for blood alcohol levels for drivers? I ever interacted with the police that I work with that, why don't we test all victims of road traffic crashes at A&E for their blood alcohol levels? And even the victim, maybe they have crashed into somebody, whether you are a pedestrian or the rider, the two of you should be tested. Because if I'm not intoxicated and I'm driving, and on the road there's somebody who is drunk or high on drugs, tramadol, cocaine, and is misbehaving on the road and then suffers a road traffic crash. At least if you have these levels, you'll be able to defend or you either defend somebody or you get somebody to answer for their actions or inactions. So you may ask how most of our labs are not doing it. If you want it to be done, there are labs that are doing it. Lancet does it, Ghana Standard does, Authority does it, and so many other labs. Victims of animal ferocity. Most of us think our security is not guaranteed, so we get domestic animals as pets that also double as security. But once in a while, these animals may attack their owners or strangers. And usually when it is a stranger, the stranger expects that the owner of the dog should bear all the medical costs and everything. So these cases are also medical legal cases. And here you are interested in preventing tetanus. So you do your tetanus prophylaxis, do the wound care. But if this animal is a rabid animal, and we know we are supposed to watch the dog for how many days, involve the vet, review their vaccination card, all those things may not be sensitive or specific. The best is you kill that dog, take the brain, send a piece to the pathologist, you put it under a microscope. If you find something called the negri bodies, negri from negro, black body, then you say, yes, this dog is rabid. And then it's a public health concern because if you don't eliminate that animal, it could cause death. We know that mortality for rabies, full-blown rabies, is 100% or almost 100%. Snake bite or insect bite. The snake bite, we know it depends on the type of snake and the type of envenomation that it produces. Most of the time, it is more than one envenomation, neurological with hematological, or just the local tissue injury, soft tissue injury, or all of them. So when we have animal bite, like snake or insect bite, we need to follow the protocol rigorously. And their treatment may also even lead to anaphylactic reactions, which may end up in the death of the person, which I mentioned in my early remarks. So it's important. No matter the situation, a bee sting can later on produce an anaphylactic reaction, angioedema, and then death. So you have to give appropriate treatment and then observe for at least 24 hours before you discharge. The unconscious patient is a very complex case, especially if that person is an important person. If we remember some very rich, polygamous, and demented or elderly man in some hospital, two of the wives and the children were in the ward fighting, and the man was lying there innocently. So you can imagine this is a person that is alive. What happens if alive and conscious? What happens if they are unconscious? I've had a case where an old man, also rich, polygamous, who was living with the second wife. The first wife was elsewhere. The man has property and money. And so they normally bring him for his routine care. And then when we finished, they took the man out and they told me, Doc, we need a certificate so that we can take it to the bank and then they'll file it anytime we want money, because he's too old and he's no longer thinking straight. We will now be managing the accounts. And I respectfully declined and told them to let us subject the man to all manner of tests by psychologists, neurologists, everybody that will give a complete medical report that indeed the person is not having the mental capacity. Then people who have Glasgow Coma scale of 8 or less require mandatory CT scan and some ICU care. So be very careful about this. For these kind of patients, it's always better to handle them in a multidisciplinary manner. Doctors must be well versed with the Criminal Offences Act, the part that involves criminal abortion. I know Dr. Ado in April will be giving us some lectures on the debate on criminal abortion. So if you are interested, kindly register. Dr. Katiba will give you the link and we'll meet in April 12 to 19 for that discussion. Medical legal cases have become so important that it's a whole unit. There is a whole unit at the Ghana Health Service headed by Dr. Maurice Ankra on these cases. And you would realize that recently the health minister in at an event said that they are worried about the incessant lawsuits against healthcare workers. This means that this particular area of medicine is very important. The cases are rising, the consequences are dire and expensive. And so we as doctors should be careful about drugs, lethal combination of drugs, dosages of drugs, anaphylactic reactions of drugs, and then antidotes of drugs. So in this case, even if you study the pharmacology and you have to take care of somebody, it won't hurt if you include a pharmacist to help you make the correct selection and correct dosage. It won't change anything. Our healthcare, globally, healthcare systems regarding medicine, medical practice in the US is usually, it favors the victim. So we say it's a pro-victim legal system. Once the patient claims that A and B has been done to him or her, then you have the burden to prove that you did the things the right way, you were not negligent, and so you should be set free. So it's very difficult, and that makes healthcare very expensive in North America. And that makes them to do what we may term unnecessary tests, because you have to make sure you do things well to avoid being dragged into legal suits. The UK system is opposite, where the state favors the professional or the health professional system. So you, the alleged victim, you have the burden to prove that the health personnel or the institution did something to cause you damage, were negligent in their approach or services to you. Death is a huge one under medical legal cases. But today we'll not discuss this into detail, because if you look at that knowledge fiesta we have in April 12 to 19, I will be presenting on death, a lot of things about death in forensic pathology. So here I just want you to know that a medical legal case exists when death is pronounced or remains are found indicating that a human has died and that death is suspicious or violent. So any death that comes, you think there's suspicion of violence, suspicion of poisoning, is sudden and unexplained, or you discover parts that indicate that they are human parts, you have to report. There was a story that people were digging graves elsewhere because they needed the bones of dead people to grind into powder. Then they inhaled that to become high. You can imagine. So these are all things we should take note of. And what happens if you inhale that? What are the public health concerns about such activity? Going to exhume a body illegally and taking parts thereof. So please register for the MDC accredited program. It's loaded with CPD points. It will be going to happen at the regional hospital in April 12 to 13. Some few guidelines on handling medical legal cases, and I'll rush through these ones. We as healthcare workers must continuously improve our knowledge, skills, and professional conduct by attending these CPD programs and reading around the medical legal cases. You could even go to court to sit down and listen to one or two medical legal cases to learn one thing or two. Never delay the assessment of a medical legal case, whether it happened night or day, because injuries change with time, evidence disappear with time, evidence can be contaminated with delays. And it is usually best to work as a team and let the person who has the best expertise regarding the case be the lead. It won't kill you. Seek help and clarify your doubts. You remember that medical legal cases may be hospitalized or appropriately referred for various reasons, as a lack of facilities, lack of expertise, and so on. But the key word here is appropriate referral. I have read the referral policy, and it is quite clear, very, very, I won't say so unambiguous, but it is a very good policy document that you should read to guide you. When you have to refer somebody, do the needful, so go through the history examination, what you can do within your context, and then do the referral. Ensure that the patient gets to the referred facility by informing them beforehand, letting them prepare. Always obtain informed consent prior to medical intervention whenever possible. This is a big one. One day, Dr. Ado may have to take us through informed consent, because someone coming to the hospital does not necessarily mean he consents to procedures and interventions within the facility. So there are types of consent. I'm not a legal person. I'll just say obtain informed consent before every medical intervention, whenever possible. If death is inevitable, we know that we don't allow our patients, relatives, most of the time to be around. But when you see that there are some cases of unconscious or a dying person, you may arrange for loved ones to be around, because at that point, quality of life is more important than quantity of life. Some people may even want dying declarations to be made. So you arrange for the right officials to do that. Stick to the standard treatment guidelines of the country and your institution, or the international ones, so that when you are called upon, you have a document to follow. This medicine, people practice it years before us. We cannot come and claim to be the custodian of the medical knowledge. So follow treatment guidelines. When there's the need to take samples for evidence or for tests, we must do it appropriately, preserve it appropriately, and then maintain a good chain of custody. I've taken samples from here. I want it to be tested in Accra. I have to package it well, label them appropriately, preserve it well, and submit it in a very good time, such that it don't go and lie somewhere. If I send something by STC on Friday, knowing very well that weekends, standard authority doesn't work, it will go and lie there for a long time. And then by Monday, they may go back. So we have to learn how to do that. You can always consult the lab people for help. In case of discharge against medical advice, kindly report the cases to the police if there are medical cases. For anything against medical advice, you have no control over that. The people abscond. Once they abscond, report the police in writing. Our advice in writing than oral, because your words can be changed or twisted. Always remember the 4 tenets of medical ethics and our code of ethics as written in the booklet that Medical and Dental Council gives us. Do good, do not do harm, let patients make informed choices and be fair in giving them treatment. Maintain confidentiality, and then don't issue legal documents hurriedly without due diligence. Do not issue medical cause of death in all suspected or BIP cases. Wait, let the police decide if they will make the case a coroner case where they will do an autopsy or not. So the same applies with excuse duty and police reports. I know some banks, and recently a lady called me that she wants excuse duty because auditors have come to their school and then she was not present in school for so many days. And I asked, did you come to the hospital within this period? He said no. Were you sick within that period? He said no. She just wants the excuse duty to submit and then that will be the end. And I said no, for me, it's not appropriate because if I'm the auditor in your school, I'll ask you why you didn't collect the excuse duty the day you were sick, and you are only bringing it the day you are asked for it. So be careful with these things.
Minimum.
So this particular slide is what I will say. If you have forgotten everything of all the guidelines, remember this slide. Be cautious of VIP cases, and they are represented by 7 Ps. Politicians. The politics is mainly a game of perception. Some people are not as powerful as we think, but you have to be very careful when dealing with politicians. Be careful with the police. Be careful with the press, the media, because the moment you do something, even if it's a standard and you are not negligent, because they are in the media, they can destroy you, and bad news sell faster than good news. Be careful of legal people, prosecutors. They say they are learned, so any other person is unlearned or something, so they can try to bully you because of legal gymnastics. Be careful of so-called popular people, celebrities. Be careful about professors. Academicians are very, very complex people. If they just think like the lawyers. Once is a professor in animal husbandry, he thinks he knows more than the house officer because he is a professor. But most of them forget that the programs are different. And also be careful of peasants, extremely poor people. When they come to the hospital, most of us, we crack our heads because you have to take care of them, to keep them alive, to ensure they are getting the best treatment. But here's the case, they don't have money to pay for the good stuff. So even if you borrow and then use it on them, after that, how to get it back is a problem. So when you have these things, be careful. Also avoid being negligent. And the essentials of negligence are duty towards the patient. That leads, or deficiency in duty, that leads directly or which directly results in damages. Let me put it again. The essentials of negligence to remember is for this: duty towards patients, the appropriate duty towards a patient, which is not deficient or short of the standard, which directly results in damage. The damage will be physical, mental, financial to a patient or their relative. If you remember this in every case that you handle, you avoid a lot of medical legal cases. Add this to proper documentation and good consent, and you are good to go. Also avoid the 6 A's of professional misconduct: alcohol intoxication at work or before work, illegal abortions, drug use of addictive drugs, adultery. I mean, it's having sexual relationship with patients and their relatives, or associations with pharmaceutical companies, like that you throw away your ethics and just push their products. and then advertising as a doctor. So why is it difficult to handle medical legal cases? The challenges of handling medical legal cases for health professionals, especially doctors, is one, education. We do not have a lot of education on legal matters. You go to school, and probably the last year and before the old swearing ceremony, you are called and you are given some crash course on medical legal or medical ethics. That's not enough. And every year you are supposed to attend some CPD program, and it may just be one for the entire year. So we have to gradually weave this into our curriculum somehow so that we pick it up early enough and learn about them. Sometimes there's a dilemma. How do I, which case should I classify as a medical legal case? Or what time is appropriate to make a case a medical legal case? I had a case of a police officer that was shot 2014 in Ghana region, 8 years ago. And this year, he's going around looking for police report and disability assessment so that he can go and make claims at his office. And when I questioned him about the whole thing, you see that, yeah, 8 years, he still has some bullets inside his body, but why the delay? Why did he have to change the region? I even asked for past records. He says they are Wenchi, he can't trace them. So education is one of the challenges, and we should make conscious efforts to learn, open our minds and to learn. Dr. Ado is there. I believe there are nurses and doctors and pharmacists who are lawyers now. You can always ask or ask senior people for help and direction. The law enforcement, they are so difficult to deal with. They appear slow, too slow for our liking. They behave like they are tricking us. They will ask you to say one story over and over and over and just looking for a loophole. They may not be trustworthy because you will be telling them something, and by the time you know, one of them is sitting in bed with the client who is being managed as medical legal case. And generally, doctors fear the courts and the legal aspects. Legal people, we can read 20, 30 pages of Harrison, but when you tell us to write a simple police report, we are shying away, we drag our feet because we believe they lack professionalism. And dealing with the police is time consuming. One thing, they will go round and round and round and will come over and over. So that also makes it challenging. Sometimes we feel that we are insecure in cases of medical legal cases involving suspects of crime or violence. That maybe if we get involved, these suspects, when they are released or their supporters, can come and attack us because they do attack lawyers, they do attack even the police. So how much more about the doctor? And we also believe that there is no material benefit in helping the legal system. So what do I have to gain from this? And the police will be calling you, and what do I get from this? So we don't want to involve ourselves. So why is handling medical legal cases by doctors and health professionals important? In one sentence, is just to assist the law enforcement organizations or officers and the courts to enforce our criminal law. What is our criminal law? Or what is the function of our criminal law? It is simply one, to help fight crime. And crime, one of the definitions of crime, which I got from Isia Jabing, OSP's notes, is that a crime is that act of omission that the state would punish the offender and or reward the victim. So when we do due diligence with medical legal cases, we are helping to fight crime. We'll also be protecting the citizen from what is offensive or injurious. And If we do that once or twice, we realize that people begin to be afraid in committing crime. So we deter conduct that threaten or harm our society. Then we will eventually provide a sufficient safeguard system where the poor and vulnerable will not be exploited, or people who are morally bankrupt will go on corrupting others. And when we do all this, essentially, we will preserve our public order and decency. So the function of criminal law will be upheld. And which function is that? Is the most coercive method of regulating our behavior. Our behavior will be regulated so that we have peace, we have decency, and we can all develop and enjoy our lives. In conclusion, I want to say medical legal cases are quite important, very important and quite common. And healthcare workers have a role in fighting crime and ensuring public safety by our training, by our skills and our profession. Unfortunately, there are no policies or protocols on management of medical legal cases. If we had them, they will be helpful, just like the medical course of death certificate book. It's a template line that everybody who has gone through how to do it should be able to do it. But sometimes the cases and the medical legal aspects and how you should approach it, we don't have them written anywhere. So it makes it difficult. Nonetheless, we should do teamwork and call the appropriate quarters for help. The concept of medical legal register. Elsewhere, all these cases that I've mentioned, once you have finished treating them, you should enter it just like the OPD register, so that when you are even absent, we can be able to trace and even generate data to help the law enforcement and to help hospitals to plan and to function. Where I trained, there are separate institutions called the Medical Legal Institutes, where patients are first taken care of by the doctor and given the medical certificate to go to the Medical Legal Institute for them to now take them through the necessary processes. Unfortunately, we don't have those yet, but I think it's a better system. That way, police will not be invading privacy of people in the hospitals, interrupting our work. And when they need something from you, you can see their desperation and pressure. But when you need them, probably sometimes it's very difficult. We lack medical legal document templates, which I already mentioned. So I think going forward, if everything depends on data, you will keep a medical legal register. I saw a letter signed by the National Security Minister that a hospital in Eastern region was not helping them because people sustain gunshots, come to the ER, they manage them and do not report. If you do that, a criminal has come, you take care of them, you don't report, then he goes back to committing crime. Or police officers come to you that they want excuse duty. Meanwhile, they are having weapons. You give them the excuse duty, then they pick their weapons and probably join criminals to be reporting armed robbery. So don't take any of those medical legal documents lightly. They are very important. These are my references for further reading. I want to say thank you to everyone. Back to you, Dr. Katiba.
Thank you very much, Dr. Moore, for this excellent exposure on medical legal cases. An excellent job done. I've learned a lot, and I'm sure a lot of our participants, all of our participants with us today would have learned a thing or two. Thank you for a brilliant job done. God bless. If you have any question, kindly electronically put up your hand, and then I can unmute you to ask, or if you have a contribution to make, please go ahead. We've gone 4 minutes, top of the hour, so please be brief so that then we can close in. Dr. Charles, I've asked you to unmute yourself. Please go ahead and make your submission.
All right. Thank you very much, boss. I have a number of things, and thank you very much, Dr. Moore, for your presentation. In fact, it was actually enlightening. but then it looks more like an ideal situation than the real situation on the ground. Why am I saying this? You sometimes get a case of assault, maybe domestic violence kind of situation, where the client comes to the clinic, you refer them to go to the police station to get a medical form. Then they refuse to go. So at that point, what do you do? Because the person has come with the husband. Husband says, "Oh no, it's a very simple matter." Wife says, "No, the man has been beating me." So at that point, yes, you owe the person that duty of care, but then they are refusing to do this. That's the first issue. Then you spoke about intoxication and drunkenness in the case of an RTA. You spoke about doing probably a screen, either blood alcohol level or even to do a toxic screen. But then let's ask who would pay for this, because obviously the client doesn't want to do this test, but you are saying that it must be done. So even if you take the sample, who pays for it? Obviously, facility will not pay for it. You, the doctor, will not pay for it. Patient will not pay for it. I don't think the Ghana Police Service will pay for it. So in that situation, what do you do? Then the next is on DAMA. In case of a DAMA or LAMA, if a client returns probably the following day to the clinic in a very acutely ill stage, what do you do? Because the person requested, either person requested to be discharged against medical advice, or the person left against medical advice and comes back the following day, probably gasping for breath and all those things. What do you do in that situation? These are a few things. Then the other thing is on the criminal abortion you spoke about. I don't know, criminal abortion, induced abortion. I know very well during my house job training, they advising us against the use of criminal abortion. I don't know whether maybe you could enlighten us a bit on it, on criminal abortion, whether it's the same thing as the induced abortion we're talking about here, or is it a whole different thing? Thank you very much.
Thank you, Doc, for your patience. Reporting the cases. You want to report maybe domestic violence, the husband says, no, it was just a misunderstanding. Well, that's what I said. Most of us in our facilities do not have even a register or a place where we list down all such cases that should be categorized or treated as medical legal cases. Now, wherever you are working, especially if you are the head of that institution, you would see that most of the legal documents are always addressed to you. You are part of the district security and all this local government system indirectly. So you have to get to on a Zooming post, you have to create some rapport with the police. This I'm just giving you an advice based on experience, not that it's carved on stone. Get to know the police authority over there and ask them, when you have cases of this sort, who among them should you be reporting the cases to? Mind you, you are not supposed to do beyond reporting. You can report and they can take it up or not. The same with even the cases involving death. Somebody can come, be BID, you report to them. It's up to them to decide that they will go to the magistrate and get you coroner's forms for autopsy. So get to know your environment, what works for you. I don't know any standard procedure, anything carved on stone that when it happens, do it this way. But we all have to, for me, when I was at UBS, I had the numbers of the commander. I'll call and tell you, say, oh, report to domestic violence units. I write and go and give it there. I don't hear anything from you, it's up to you. If one day anything pops up regarding the same case, I have a copy to show you that I reported, but you didn't take action. Now, I mentioned the challenges that we are afraid. The couple have come with the domestic violence issue. You have reported them. Police didn't do anything, and you have an enemy back in your yard. So this is a real challenge that we have to deal with. But if you really feel that the case has the potential to come back to you, land on you, ignore and report and let the police decide to act or not. On intoxication, the payment is very difficult to get money from the police. When I spoke with the police, they said they have to get authorization from top before they will allow me to be testing people or victims of RTAs that are referred to me. But cases that are really, really of the state, criminal cases, the state is supposed to fund them. They delay, but the money comes. So if you take the sample well and preserve it well, as I said, the custody or chain of custody is you pick, there's a format by which we write it, address to maybe the police commander, submission of samples for ABC. I forward here with samples taken from Mr. ABC, age this male, who was involved in RTA. The samples are 1, blood, 2, urine. It is submitted to constable or sergeant, his name, their number, and then, when you are giving such documents to them, make sure the person who, the police officer receiving it, writes their name, appends their signature, and then the date on that same document before they go and forge it and then put you into trouble. Just like the way you handle the medical cause of death certificate, you flip it over and the person who is taking it writes their name, their address. This is from me, I ask for Ghana card. I'll take your Ghana card, write your Ghana card number, and then, or health insurance number before you sign and then go. On DAMA, you have no, I won't say legal, but it's unethical for somebody to take the DAMA and return to you, and you say you would not attend to them. You will do what you are supposed to do. You are supposed to give them that duty of care and allow the outcome, whatever outcome it is, to come. And I came with a broken leg, took DAMA to go and do traditional. Now I've come, there's extensive necrosis and infection. You amputate it, that's all. Once you have done the assessment and the standard treatment at that point is to amputate it, that's it. If the person is septic, cannot go to theater, you give antibiotics and they die, that is it. You just need to keep their DAMA letter very well. And when you are doing your notes, indicate that he had come earlier and taken DAMA on so and so day, see copy of letter attached somewhere, you are covered. Then criminal abortion. I think I agree with you. Terminology is what, or semantics is what we are talking about here. So in the training, they try to, medical school training, they try to make us avoid using legal terminology. So it's unsafe abortion. Unsafe abortion, that I should have made it an unsafe abortion. That means done by somebody who is not qualified to do it, or at a place that is not designated for it. That leads to damages or injuries, physical or otherwise, to the particular woman. That's basically how I'll paraphrase this type of abortion that we'll consider as a medical legal case. Thank you.
Great. Thank you very much, Dr. Moore, and thanks, Dr. Charles, for the questions. Unfortunately, I think we've gone way past the hour 4, and so we can't take any more. Dr. Moore, I think someone put up a question in the chat box. I see he's just asking you if you could go back to your references. I'm sure he probably wants to have a look in his further reading. So if you can probably just show the slide of the references for the person to, yeah, fantastic. So you can have a look at that for your further reading, like you put up in the chat box. So I just want to, on behalf of all of us, thank Dr. Moore for an excellent job done for taking us through the medical legal case and enlightening all of us. I'm sure it will go a long way to improve upon our practice. We are so much grateful, Dr. Moore. And we are grateful to all the participants who joined us today for this presentation. We have about 41 people on the call. We are thankful that you join us every week to do this. like I indicated at the beginning of the presentation, if you do have a topic or you went for a refresher training, you have something new and updated knowledge that you want to share with all of us, please reach out and then we can always help one another to learn. Thank you so much. And please take good care of yourselves and have a great day and a lovely weekend as we move over into a new month. Thank you so much. God bless all of us. Thank you once again, Dr. Moore. See you guys next week. We'll be doing something on pediatrics. I'll advertise the topic when Dr. Matilda makes it available. Thank you so much. Bye-bye.